We know that Santa Clara County is the epicenter of this outbreak in the Bay Area, and we know that COVID-19 is spreading rapidly. We all must do our part and ensure that our essential services remain intact and open, most especially our hospitals and healthcare facilities.
It's a bit of a blur thinking back to those first weeks and months.
In some funny ways, it feels like a long time ago.
I think all of us were a combination of exhausted and terrified.
We were all a little bit overwhelmed and a little bit stunned.
And wanting to do everything we could to rise to the challenge.
When we first heard about COVID, we didn't know much about this disease. I still remember the first day that I was on call when I had to go down to the emergency department and we had our first COVID case. I remember the staff being anxious and scared. We wore some protection and we went in and the patient had a fever, cough, shortness of breath. We were able to give oxygen and we only had a few COVID tests. We applied that test to this patient and were able to make the diagnosis. But I wondered at that moment how many more patients were going to come through that door and how would we manage that? And a few days later, I remember getting a call from one of my primary care docs, and he had just seen a patient in the clinic with a sore throat and had swabbed the sore throat. And unfortunately, that patient ended up in the hospital about a week later and died. And then that doctor started developing symptoms, and that's why he called me, because he had a fever and a cough. And he asked me if he was going to die. And that's when it made me recognize how the impact this would have on our staff.
The surges of the pandemic were so great that at some point, more than half our hospital capacity and pretty much our entire ICU was filled with COVID patients. And we had to keep our healthcare workforce safe.
As we cared for people with COVID, we also feared for our families.
After a long day of work, I would have to go home and I would have to change my clothes in the garage. Sometimes I would have to stay in a hotel if I thought that the risk was higher and I saw a lot of patients. And that was tough, that was difficult, it was exhausting for our families.
For us, we wanted to make sure, well, let's do everything we can and contribute everything we can. And we didn't know what that would look like. But it turns out, for an organization that normally is focused on fundraising, pivoting to seeking donations of materials and supplies was right in our wheelhouse. We knew exactly how to do this. So we put together very rapidly a massive campaign to acquire whatever PPE and cleaning product and anything else that we needed to keep healthcare workers safe from the community. And the community response was amazing.
And that happened because people sprang into action. People like Gary Goodhart.
Intuitive, right away, got to work manufacturing face shields locally. Over 1 million eventually came to us that were then deployed for healthcare workers around the county.
The mission of Intuitive Surgical is really to bring the best possible patient benefits to patients everywhere, and to use technology in order to do that. The pandemic changed everything. We found ourselves in a situation where the immediate need of a community in crisis was something that the Intuitive Foundation and Intuitive Surgical needed to respond to together.
We just wanted to help out. We said, who better to answer the call than Intuitive?
This gave us a unique opportunity to be able to convert some of the manufacturing we were doing over to help ease the PPE crisis.
Catherine and everybody else was like, well, if you guys can do that, can you do 100? Can you do 1,000? Can you do 10,000? Can you do 100,000? Can you do 1 million face shields? So that's what started the oiled machine.
One thing that set Intuitive apart, and I think this speaks to Gary and Gary's leadership, is their focus and their commitment and the fact that they stuck with us all the way through. Gary gave personally time and again large cash donations so that we could buy material and supplies. The Intuitive Foundation led something called the Silicon Valley Aid Coalition, which developed purchasing guidelines for the PPE and supplies we needed so that other Silicon Valley firms using their own supply chains could find what we needed, buy it for us, and get it delivered to us in time for us to deploy it. It was an incredible sustained effort by Gary's team and Intuitive from the earliest days of the pandemic, really all the way through now.
I would describe Gary's leadership style as very, very collaborative. He is a person who asks a question and then listens very deeply to a lot of people bringing answers and data coming in, and then seeks to drive a consensus around what we ought to do.
He spent most of the time listening, and he helped us get organized, set the priorities, and understand what the challenges were. And then he got out of the way, right? And that, to me, showed a combination of that values-based leadership and then trust.
Gary's leadership style is really lead by example and do it from the heart. Look at the way that you would make yourself or your family proud.
Humility is a core value for Intuitive, and it's a core value for Gary, I know.
People trust the decisions that he's making and will follow them and execute them because they know they're coming from a good place.
I think that's a credit to the culture of the company, and that's a credit to Gary as a leader, because clearly he is setting the tone.
And the thing I really appreciate about Gary and his amazing team is they not only hung in there, but there's a type of leadership that demonstrates caring by being present. And they were present. And so I am grateful because I think that when you have organizations and individuals that lead that way, they inspire others to give, and that saved lives. So thank you.
Thank you, Gary, for your leadership in this time of crisis and for transforming your company to support our healthcare workers.
It means the world to our community to have you stand behind and rally to help us.
Thank you for working with the VMC Foundation to really support us during this time of uncertainty in a global pandemic.
Gary, you have changed the course of the Valley Medical Center Foundation. You have been our ultimate champion. We will forever be grateful. Thank you.